1 in 7 women experience postpartum depression, a good percentage of which are linked to breastfeeding challenges. This is a fact that is often overlooked, and we're here to discuss today. The motherhood journey, though beautiful, can have some tough periods. One such issue less discussed is the connection between breastfeeding problems and postpartum depression. It's not just about physical discomfort, but an emotional upheaval causing intense sadness and depression. This condition, dysphoric milk ejection reflex, DMER, is a sudden mood drop before a milk letdown. It's a physiological response and is quite common. According to the World Organization, approximately 10% of pregnant women and 13% of recent mothers face a mental disorder, largely depression. This is higher in developing countries, nearly 15 to 19% during pregnancy, and nearly 20% after birth. This issue often goes unnoticed because breastfeeding is typically seen as a blissful bonding experience. But for some women it's a time of stress and pain. When these persist, they overshadow the pleasure of motherhood. It's not a passing phase. It's a valid struggle that merits attention. Recognizing these issues can help us better support new mothers and create a supportive environment where they feel understood and not alone. Because every mother deserves to experience the joy of motherhood, free from the shadows of undue stress and depression. We sat down with some leading experts to discuss this issue. Here's what they had to say. Postpartum depression, a condition affecting many new mothers, is often linked to breastfeeding difficulties. Experts, including psychologist Dr. Jane Foster and pediatric nutritionist Dr. Sarah Mitchell, delve into this important issue. According to Dr. Foster, hormonal changes during breastfeeding trigger depressive symptoms. Difficulties with breastfeeding such as latch issues, pain, or low milk supply can increase the likelihood of postpartum depression. Dr. Mitchell adds, maintaining a balanced lifestyle is also crucial. The stress of caring for a newborn can lead to depression, especially if coupled with an unhealthy diet and sleep deprivation. The emotional toll can be significant, often leading to feelings of inadequacy. Societal pressures surrounding breastfeeding can exacerbate these feelings. Dr. Mitchell states, women often feel pressure to exclusively breastfeed, leading to guilt and self-doubt. It's important for society to acknowledge the realities of breastfeeding, both the joys and the challenges. Formula feeding is a valid option that can alleviate stress for struggling mothers, Dr. Foster concludes. These insights from our experts provide a stark reminder of the challenges many new mothers face. It's not just about nourishing a baby, it's also about nurturing the mother's mental health. These insights provide a stark reminder of the challenges many new mothers face. So what exactly causes depression in breastfeeding mothers? It's primarily due to a mishmash of factors. The most significant one is hormonal changes. During breastfeeding, hormonal fluctuation can stimulate depressive symptoms, particularly when mothers face breastfeeding complications. The lifestyle of a breastfeeding mother also enhances the risk. The challenge of balancing newborns' needs with day-to-day life responsibilities, often on inadequate sleep and diet, is taxing. The emotional impact of these difficulties can heighten feelings of inadequacy, increasing the risk of depression. Lack of support or any medical issue preventing breastfeeding can further cause stress. Adequate support plays a vital role in the emotional well-being of a new mother. Societal pressure surrounding breastfeeding can also contribute to postpartum depression. Women often feel pressured to exclusively breastfeed, leading to feelings of guilt and self-doubt. It's important to acknowledge that every mother's journey is unique, including the option of formula feeding to alleviate stress. There isn't a one-size-fits-all solution, and flexibility is key. The causes are many and varied, highlighting the need for a comprehensive approach to support. It's vitally important to ensure mothers feel understood and supported during their motherhood journey. If you're a new mum or know one, it's crucial to recognize the signs of depression. Depression, particularly postpartum, manifests in various ways, sometimes subtly. Every woman's experience is unique, but common signs act as red flags. A key sign is a mood shift, displaying feelings of sadness, despair, or hopelessness consistently and unrelated to specific events. You may experience guilt, worthlessness, or helplessness. Depression also has physical traits. Changes in sleep patterns can mean trouble falling or staying asleep or excessive sleeping. Appetite and weight fluctuations can signal depression, possibly showing as eating too much or too little, leading to significant weight change. Depression can alter a woman's behavior. She may lose interest in activities she once enjoyed, avoid social gatherings or daily tasks, and struggle with concentration, decision-making, or memory. Restlessness or irritability can be constant. Recurrent thoughts of death or suicide are critical depression signs, requiring immediate help. These signs vary among individuals, and one or two symptoms don't necessarily indicate depression. But if persistent and life-interfering, it's vital to seek help. Depression is a serious but treatable condition. Recognizing these signs is the first step towards help and management. It's okay to ask for help. It's okay to prioritize your mental health. Being aware of these can be the first step towards seeking help. Our experts also shared some advice for women experiencing these issues. Specialists stress the necessity of self-care and reaching out during breastfeeding struggles. Prioritizing your own needs is vital. Balanced meals, sufficient rest, and personal time can alleviate stress and bolster well-being. Psychologists and lactation consultants offer practical solutions for breastfeeding hurdles and emotional distress. They insist on not hesitating to seek professional help when overwhelmed. Your close social circle can also provide support. Sharing your experiences can provide emotional solace, and they can assist with practical tasks, allowing you to tend your own needs. Experts suggest setting realistic expectations about breastfeeding. Every mother's journey is unique, and it's okay if yours differs from others. Understanding this can ease guilt and self-doubt. They also recommend exploring other feeding options if breastfeeding is causing significant distress. The primary concern is your baby's nourishment and your mental health. Finally, don't hesitate to seek support if you're struggling. With resources like online groups, hotlines, and local services, you're not alone. Many mothers face breastfeeding challenges, and there's no shame in seeking help. Remember, it's okay to ask for help. Stigma and societal pressure can often hinder women seeking help, especially when it involves breastfeeding difficulties and postpartum depression. Society's perfect mother image, one who breastfeeds effortlessly, is removed from reality and can induce feelings of guilt in new moms who struggle. The stigma around postpartum depression impedes women from seeking assistance. It's often dismissed as baby blues or normal fatigue, but is a condition necessitating medical attention and care. Regrettably, societal norms can heighten feelings of isolation and depression. We must challenge these stigmas and foster an environment where it's okay to discuss these issues and seek help. Each mother's journey is singular. What's useful for one may not be for another. If breastfeeding isn't feasible, it's fine. Other means to feed and bond with your baby exist. Formula feeding isn't acceptable, and it doesn't make you any less of a mother. It's key to understand that postpartum depression is a medical condition, not a character flaw. There's no reason for guilt or shame. We must remember it's okay to ask for help and take care of ourselves. As a content mother makes a happy baby, it's time for us to normalize these conversations and support new mums in their decisions. If you or someone you know is experiencing these issues, important to seek help. The idea of asking for help can seem daunting, but remember, there's no shame in reaching out. It's courageous and necessary. We now live in a time where assistance is readily accessible. There are countless resources, both online and offline, to provide you with the support you need. Lactation consultants can help with breastfeeding difficulties, offering advice and emotional support. Support groups and online communities can also be beneficial, providing a safe place to express your feelings and learn from others. Don't hesitate to discuss your situation with your healthcare provider. They can help identify if you're dealing with postpartum depression or DEMA and suggest proper treatment options. It might be therapy, medication, or lifestyle changes. Remember, it's okay to ask for help, even with your baby. Ask family, friends, or a professional caregiver for assistance. And if you're feeling pressure to exclusively breastfeed, remember that other feeding options are okay. There's no one-size-fits-all solution for feeding your baby. Your mental health is important. Depression is a serious condition that requires attention. Remember, you're not alone. Help is out there, and it's okay to ask for it. Don't let fear or pressure prevent you from seeking help. You matter.